We're here today to let Texans know about the abundant hospital capacity that exists to treat Texans who may test positive for COVID-19. Now understand the context we're dealing with. We are in the middle of a short period of time where all of us have to coexist with COVID-19. The reality is COVID-19 still exists in Texas. It exists in the United States as well as across the entire world. And this is going to continue to be the case for at least a few more months until we have medicines that are able to treat people who test positive for COVID-19 and until we have medicines that are able to prevent people from getting COVID-19. And remember this. Go back to March and April earlier this year when there was a nationwide effort to slow the spread of COVID-19 so that we would be able to prevent hospitals from being overrun. Importantly, that goal has been achieved. Fewer Texans test positive for COVID-19 than residents of any large state in the United States. We have the second lowest death rate of the 25 most affected states in America. Only about 10% or even less of Texans who test positive for COVID-19 ever even need to go to the hospital in the first place. And when they do, there is a hospital bed there available for them to be treated. Well, as we continue the process of opening up Texas, as we continue to have Texans return to their jobs so that they are able to earn a paycheck that will help them pay their bills and put food on their tables, we at the state level, as well as our peers across the entire state at the county and local level, we remain laser focused on maintaining abundant hospital capacity. Now, Dr. Zerwas will be providing a more detailed, in-depth update on hospital capacity in Texas. But first, there are a few points that I want to stress. First, more important than the numbers that you may hear about on a daily basis are the reasons behind those numbers. Let me just give you one example. It goes back just a few days ago to June the 10th. That was the day at the time when we had the most number of Texans who tested positive for COVID-19. The number was 2,504. If you hear that number and saw how large it was and saw that it was the highest number of people testing positive, that would be a big reason for concern. If, however, you look behind that number and looked into the reason why there was such a high number that day, then it provides a different level of context. Let me just mention two counties out of the 254 in the state of Texas that had an outsized influence on that number that day. One is Jefferson County, which is where Beaumont is located, which is also where we have multiple state prisons and a federal prison located. Beaumont and Jefferson County, they average about 12 to 15 positive cases per day. On June the 10th, however, they had 537 people who tested positive. About 520 of those came from a batch of positive tests that had been aggregated of inmates in the Texas prison and federal prison system that all came back at once. And hence, as opposed to having that spread out over a number of days, it elevated one single day from 12 to 15, way above 500. Another county, small little Pecos County, Texas. They average less than 2 people testing positive each and every day. On June the 10th, there were 92 who tested positive that day. Obviously, a massive aberration. We looked into it, and we found that there was a data error. As opposed to 92, the correct number was 2. So if you just look at only those 2 out of 254 counties, you can see that there were certain reasons why on June the 10th, there happened to be a massive spike or increase in the number of people testing positive. I want you to know that this is the same type of analysis that we use on an ongoing basis as we look into each and every county across the entire state of Texas to figure out exactly what is going on. The reason why this is important is because knowing what is going on that leads to an increase in the number of people testing positive, it informs us how the state needs to go about responding to the challenges that may exist in any particular county. And it also informs us about strategies that we may need to employ to make sure that we will maintain available hospital capacity. And that brings me to today. So today, there will be another new high in the number of people who test positive. Today's number is going to be 2,622. So as we look at this number, we look at counties around the state and we look at information that we have been gathering for the past several days, and there are some explanations for why these numbers are so high. Let me give you just a couple of examples. One county where it tested inordinately high is Collin County. Collin County has been averaging well below 50 per day, around 25 to 30 people per day testing positive. Today, Collin County had 120 people test positive. One reason for that is because some tests came back from an assisted living facility in Collin County, which obviously is of concern. But as we have proven in other regions across the entire state of Texas, when we have a high level of positivity in something like an assisted living facility, we're able to surge resources into that facility, get it contained, and have that number reduced back down to zero. Some other counties. Hays County. Hays County, as far as I can tell, had its highest number of people testing positive today than ever before. It had 265. But when you look back at the numbers, I see that yesterday, Hays County had 0 test positive, and the day before, they had 0 test positive. Whereas before that, they had something in the 30s or 40s being tested positive. So what this means is obviously, for whatever reason, there was no report to the state of Texas of what happened in the 2 prior days, and it seems like these numbers were batched together and averaged out. It would average out a little bit above where Hays County typically is. Now, there is a reason why Hays County, as well as some other counties, have been testing positive at a higher rate. And one of the reasons that we have learned from multiple reports across the state of Texas is that there are certain counties where a majority of the people who are tested positive in that county are under the age of 30. And this typically results from people going to bar-type settings. I can tell you that it's the case in Lubbock County, Bexar County, Cameron County. There were news reports in each of those 3 counties that a majority of the people who tested positive since the beginning of June have been people under the age of 30. It's hard to tell exactly where those people contracted COVID. It could be Memorial Day celebrations. It could be a bar setting. It could be some other type of gathering. All we know is that because these people are testing positive at a higher rate who are age 30 and younger, that informs us about certain strategies to take to make sure that we are able to reduce the number of people testing positive. An example of that is what you saw announced yesterday by the TABC. The TABC issued a warning to bars and restaurants across the state of Texas that serve alcohol that if there are any violations of what the orders are, then there will be a 30-day suspension of their liquor license for the next violation. The violation after that, there would be a 60-day suspension of their liquor license. This is necessary to make sure that all of these businesses are following the protocols and standards that have been established for them to follow, standards that were established by doctors, knowing that if the standards were followed, there should not be an increase in the spread of COVID-19. and because there have been pictures that I have seen and others have seen about these bar-type settings where clearly the standards are not being followed, I think enforcement by TABC should bring these types of settings more into line to being safer standards. I will also tell you today that there is a one-off in Rusk County, like there had been in Pecos County before or Jefferson County before. In Rusk County, Texas, there typically are not that very many people who test positive. However, there was a report of 104 people testing positive in Rusk County today, and it's my understanding that a majority of those that came back positive were a batch return from tests that have been conducted in a prison in Rusk County. Now, to go back so you'll know, Texas was very aggressive over the past several weeks to make sure that we test what are called congregate settings. One is nursing homes, where we've tested 100% of the nursing homes to make sure that those facilities will be as safe as possible. Another congregate setting is a jail or prison setting. Now, we have completed testing well over a majority of those types of congregate settings. Know that jail and prison settings, they have returned the highest positivity rate that we have seen in the state of Texas. And so now that we have gotten through most of those types of congregate settings, there is reason to believe that those testing positive, the number of those testing positive, should begin to decline a little bit. Another thing that we see with regard to numbers, I'm still continuing the process of talking about the importance of looking what is behind the numbers. One thing about the numbers, in addition to those testing positive, are these numbers that you've been seeing about an increase in the number of people who are hospitalized because of COVID-19. Let me share with you some context that Dr. Zerwas will be elaborating on in far greater detail. These are numbers from today that kind of give you an explanation. So today it will be reported that there are 2,518 people who've tested positive who are hospitalized in the state of Texas. As Dr. Zerwas will explain, that's really a very small percentage of people, a small percentage of all the beds that are available. You know, looking at the sheet that I have about all the major metro areas, there's only one county or one region in the state of Texas where COVID patients represent more than 10% of the hospital beds that are available, and that would be Galveston County. It looks like on average, it's about 5 or 6, in fact, the average is 6.3% of the hospital beds that are occupied in the state of Texas are by COVID patients, meaning that percentage-wise and numerically, there is an abundant supply of beds that are available. But let me mention two counties in particular to show you how this works. Today, there were 64 people who tested positive in the Dallas-Fort Worth area who were added to hospital beds. That said, separate from that, there were 308 hospital beds in the Dallas-Fort Worth area that became available. So even though there were more people hospitalized in Dallas-Fort Worth today because of COVID-19, it turned out that there were about 250 beds more available in that region. The same is true for the Houston area. In Houston, there are today 65 more people who test positive for COVID-19 who are hospitalized. That said, there were 183 beds more that became available. Hence, even though more people testing positive for COVID-19 were hospitalized today in Houston, there were more than 100 additional beds that actually became available. The second thing that I want to emphasize is that as we gather today, we are better prepared to deal with COVID-19 today than we were back in March and April. There are new medical strategies as well as new treatments that are available today. One is that these hospitals, they have more PPE available to them than they did just a couple of months ago. Two is they have some new drugs like remdesivir. They're able to treat patients who are hospitalized and get them out of the hospital beds sooner than before. A third strategy is a process learned as Doctors and hospitals have dealt with these patients, and that is, as opposed to treating a patient laying on their back, they will treat a patient laying on their stomach. And as I understand it, one of the positive benefits of this is it makes it less likely that the patient will need to go onto a ventilator. The third thing I want to emphasize, unlike back in March, today everyone now knows how to make safe decisions to prevent contracting COVID-19 and to prevent the spread of COVID-19. The first and most obvious is to stay at home. If you do not need to get out, the best advice is to still stay at home. Now, of course, this is especially true for those who are age 65 and older, and especially those of that age group who have some other health-based condition. We know that about 75% of the deaths of COVID-19 result from people age 65 and older with some other type of health condition. So unless you are in that age group and actually need to go out for some reason, our recommendation is that you still remain home. However, you don't need to be of that age group to still understand that staying at home does more to ensure that you will not come into contact with somebody who has COVID-19. Hence, it's just a mathematical result that if you stay at home, the likelihood of spreading COVID-19 decreases as opposed to increases. And then in addition to that, one thing that we've all learned over the past few months, and that is there are 3 strategies that everyone can use that will go a long way to slowing and reducing the spread of COVID-19. One is to wear masks. 2 is to use frequent hand sanitizing. And 3 is to maintain these safe distancing practices. You can't get COVID just by walking around somewhere. COVID is going to be exchanged by getting up close to somebody where it can be transmitted to you. So if you wear the mask, if you sanitize your hands about everything you touch, if you maintain your distance when you go shopping, whatever the case may be, you're going to be doing the types of things that will ensure you do not get COVID and that you will not be spreading COVID to somebody else. Now, the reason why I make that last point is this. You may be thinking, well, if I have COVID, I'm not going to go out. Remember, there is what's called asymptomatic COVID cases, meaning that you may not have any symptoms. You may not know you have COVID, and you may still be going out. Because you may have it and not know it, that's why it is so important for you to wear a face mask when you go out, to make sure that if you happen to be an asymptomatic COVID-19 person, that you are doing the right thing by wearing a face mask so that you're not spreading COVID-19 to somebody else. Now, these strategies that we've learned to reduce the spread of COVID-19, they also pertain to businesses in the state of Texas. Businesses have learned safe strategies for both their employees as well as their customers to make sure that they are preventing the spread of COVID-19. So much so that some businesses have recognized that even though they are able to open up for business, they have realized it's simply not safe to do so at this time. The last point I want to make, and that is we are now in a situation where we are coexisting with COVID-19, where we do not have to choose between either returning to jobs or protecting health care. We do have the tools and the strategies in place where we can achieve both of those ends. Jobs can be maintained without jeopardizing the health of a community if everyone follows the safe strategies to prevent the spread of COVID-19. The more that Texans protect their own health, the safer our state will be, and the more that we will be able to open up Texas for doing business.